Hey everybody, it's Andrea Trout with Prime IV Hydration and Wellness. We're located in Delray Beach, and now we have new locations in West Boca, Wellington, Weston, down in Broward County, and then some that are not mine in Palm Beach Gardens, Fort Lauderdale, and Fort Lauderdale by the Sea. So you have a lot of options. In Delray, West Boca, or Wellington, come see us and mention the word sweet and get any IV for $149. And especially now with the holiday season coming, keep your immune system strong and be ready for those sparkling holiday parties. We hope to see you soon. Hello, everybody. It's Andrea, aka Sweet, and I'm here with Spicy Spice.
Good morning or good afternoon.
Whatever time of day it is. Happy New Year. And I'm super excited. We have a special guest today, Dr. Bawa. And I'm so excited you're here. You have no idea. We just were chatting before we started recording. And one of the things you just said is that everybody needs some help in the world of sexual health because it's about prevention and preservation. It's not just about fixing a problem. Because you are Dr. Sex Fairy.
That's right.
Is your podcast.
Sex Fairy, yes.
Yeah. And the number one sexual health podcast in the US, right?
Yes, it's definitely been number one multiple times and also worldwide.
Worldwide. Awesome. You have a global audience because it's interesting to people everywhere, which makes sense, right?
It's an important topic, and unfortunately, people aren't discussing it enough with the respect and dignity it deserves. It becomes very often about cheap thrills, about erotic stories and things like that. I'm not saying that there's necessarily anything wrong with those podcasts, but that's not what mine is about. I mean, it's fun. It's funny. Right. I mean, I'd like to think that I'm fun and funny.
Yeah.
But I think it's a serious topic and it deserves a serious discussion.
And it's relevant to both men and women.
Absolutely.
Yes. So you have a practice in Boca, so near Delray where we're recording, and you've been there for about
6 years.
6 years. But your background was in emergency medicine, and then you went to aesthetics. And I know you wanted to ask a question about the hair because that was kind of like in there on your personal journey, the hair loss.
So I had read a little bit about your background and how your personal experience with hair loss, and you were not pleased with the experience that you had with your doctors when it came to that you thought there's got to be a better way. And so you chose to then turn to cosmetic and you started researching hair restoration and doing all of that. So I know somebody very close to me that has struggled with that their whole life. And it has been a really, really devastating thing for them. And so I'm wondering what you, and they've tried transplants and all of that, and nothing has worked. So I'm curious to know what do you do that is different than what you experienced?
I do things very differently. For instance, when I went to a doctor and said, I have hair loss, what can I do? He said, surgery. And I was a medical doctor, but I didn't realize how many things could be done for hair restoration non-surgically. Now, there's nothing wrong with hair transplants when they are necessary, but so many are not. And I do hair transplants at my practice as well, but the majority of what I do is focused on non-surgical wellness and rejuvenation. And I jokingly sometimes say, from the top of your head to the tips of your toes, and certainly all the, genitals in between.
Right.
But the thing is that I was suffering and I had a hair transplant. It was a small one. It was frontal hair loss, as many women have in the front. We tie our hair too tight, and being in the hospital and ORs and everything for years, I didn't want people touching my hair. People would say, oh, I love your hair. I'm like, stop touching my hair.
Yeah.
Right.
So I would, just tie it up and keep it out of the way. And then eventually I had traction alopecia just from tight hair pulled back. And you're like, why is your hair pulled back today? But it's not as tight as it used to be.
Right.
And so I had a hair transplant, didn't go so well. And then I had to research alternative options. And when I realized how much could be done, I was really let down. I felt very let down. I thought to myself, I can't believe that this wasn't even offered to me as an option. Because I could afford it, they just pushed me right into surgery, which is elective and cash-based.
Right.
And so it was disheartening on many levels that doctors would do that to each other and then do a crappy job at it. So I started researching it. I decided that I was unfulfilled in many ways in emergency medicine as much as I loved it. I really did love it. I speak very fondly of my years in the ER. I have many fun stories to tell. Good people, great experiences, saved many lives. But what was I doing to enhance them? Nothing.
Right.
And that's where I felt I was lacking. And so I started my practice, Bawa Medical, initially primarily to do hair restoration and facial aesthetics. But once I opened it, I thought to myself, how crazy of me to not do sexual wellness, given my experiences in the ER and the fact that so much had happened during my years that gave me a much more in-depth, what should I say? It just got me thinking about it very differently than I had ever been trained in medical school and residency. And to see that suffering, that level, that depth of suffering from things that are considered so benign. Nobody ever talks about it. Like men who take Viagra, Cialis, the shot they give themselves in the penis, Trimex or Quadmex now, that can actually cause an erection that won't go away. Now, initially, it sounds like every man's dream come true, right?
Yeah.
But then after they're done the rah-rah,
Right.
then they're like, well, it's still there. And then they don't know what to do. And then they go take a cold shower and then they sit it out. And then maybe they go take some ibuprofen. And I know this doesn't make sense, but none of this makes sense.
Right.
And then at some point, many hours later, they'll call their doctor. Invariably, the doctor's not on call, or if they're on call, the answering service takes forever to get them on the phone for whatever reason. What's the doctor going to say? What does any doctor ever say to any mess up that they create? Go to the ER.
Right.
Right.
And so I would get these people. But the sad part is that they would be so mortified that they had this problem that they would never tell the triage nurse. They would say, I have abdominal pain, I have this, I have that, some
Oh, wow.
nonsense complaint. The nurse would check their vital signs and they would be stable. And so then what? So
They're not
they're not an
emergency. Yeah.
And so it's not like we were sitting at the back eating bonbons. We were busy, but that might be another 6 hours before I saw them. By this
Right.
point, so much damage has happened that man is going to be impotent for the rest of his life because so much oxygen deprivation has happened. And people don't realize that. And I see all these sex therapists, and there's some very good sex therapists. I mean, God knows there was Dr. Ruth, good old Dr. Ruth.
Right.
But so many of them don't have medical knowledge. And so many of them do the world a disservice because they act like they know more than they do.
Right.
It's one thing to be an expert in your field, but don't pretend to be an expert in a field you know nothing about.
Right.
So these people go around saying Viagra and Cialis are incredibly safe medications. Based on whose statistics? They say Trimex is completely safe. Who said that? And they say, oh, according to so-and-so, research or study, only so many % of men have it. Except it's not a reportable condition. Every time a man had it, every time I saw it, do you think anybody reported it?
Right.
We're not expected to.
Right. So you saw an opportunity to fill the gaps.
Yes. So I was doing so much rejuvenative medicine, it made complete sense to help men and women have better intimate health, because it's not just about better sex. It's about better intimate health. Because maybe you're not having sex, and that's okay. Not everybody needs to be having sex with somebody else, at least hopefully with themselves, but they don't have to have a sexual partner. And so many women say to me, oh, I'm good. I'm not having sex right now. I'm fine. Okay, but do you really like dribbling urine all over yourself every time you laugh? Even if it's a little? Because it only gets worse.
Yeah.
I mean, what happened to living with some quality of life?
Right.
As we were discussing earlier, especially with all this talk about longevity now, people talk about lifespan and health span, but what about your sex span? What about your intimate health span? And that's why I started talking about the term sex span. And when I did my TEDx talk, I should clarify, TEDx talk in May of last year, I talked about how to biohack your sex span, because nobody's talking about that. And it's an important discussion. I think we need to think about those things.
So what are your top 2 on that? And we can link to that talk for people to watch if they want to watch it later. But what are your biohacks that you went through on that?
Well, there were a few that they actually took out. So
Really?
that talk is actually not very relevant at all, because they completely edited out all the good stuff. They said it was not FDA approved. And I said,
Wow.
what in medicine that actually makes a difference ever is.
Right. That's
Wow.
awesome.
So they cut half my talk out. And I showed them because this talk didn't come out for months.
That's wild.
And we were going back and forth, and I was sending them NIH, National Institute of Health Studies,
Yeah.
okay, PubMed studies. These are, some of them are government funded. These are reputable studies. And I was sending them proof that I wasn't just making stuff up. There was proof that these things work. And they still cut my speech out. So I highly, warn against listening to that half-baked
Okay.
speech because it
Makes sense.
doesn't necessarily make a lot of sense. It completely killed the point of that speech.
Right.
That's so
Because-
unfortunate.
Well, we're not going to cut
Mhm.
I
anything
know.
out. So you
Yeah.
can say.
No, but the thing is, it's a few different things. It's not just one thing. And like you mentioned earlier, I had said in one of my podcasts that it's like a bucket with lots of holes in the bottom, and you've got to plug more than one hole to really have a conclusive result. So sex span is really the same thing. Your sexual health is about more than just your penis or just your vagina. Your hormones have to be balanced.
Yeah.
Nowadays, there are so many of these hormone pill mills where you certainly don't have a physician. You have questionable labs being done, minimal labs at best. Most of them are running them right there and then, and most of them don't have the ability to run more than just a few labs. And so they don't really give you a full picture of where your hormones really are. I mean, how many of them are checking thyroid levels? Yeah, thyroid disease causes so many of our problems, from hair loss to sexual dysfunction.
Right.
So people need to discuss more than just testosterone when it comes to hormones. Vitamin D, it's a pandemic all its own.
Yes.
1 billion people worldwide are considered to be deficient in it. And those are just the people we know about.
Right.
So when you think about that, I think balancing your hormone health is a very, very big part of it. I think biohacking your blood flow is a very important part of it also. Now, what do you think Viagra and Cialis do for men? When men get older, when women get older too, we're all developing blockages. I mean, women die of heart attacks too, right?
Yes.
So it's the same thing. Our vaginal health too is deteriorating because we don't have good blood flow. But people think of this as a purely male issue because with a man, it's obvious. Because if he doesn't have good blood flow, he's not going to have a good erection. If he can't have a good erection, there's not a whole lot he can do.
Right.
With women, a little bit of lube hides a lot of sin. You see, so we are delusional and we want to believe what we want to believe. I'm not that bad yet. Well, how bad would you like to be? It's
Yeah.
almost
When
like,
does it become the problem?
yes,
When
well,
do you start?
it's almost
Yeah,
like
that's
they want to
interesting.
get worse before they get help because they want their money's worth.
Huh.
It's really a sad point of view that people have. And I'm not joking. I'm being very
I
serious.
believe
Right.
you.
They want it to get worse before they come in.
Yeah.
Right.
Well, how about just stopping it from getting worse in the first place?
And maybe even
Preventing
potentially preventing or
And that's-
reversing some of the
That's the focus of my
problems.
podcast to a large extent. The Dr. Sex Fairy podcast is now heard in 209 countries and territories, 14,400 cities, and 6 continents. Why? Because people need to have this discussion, and I'm trying to wake people up. And sadly, my podcast isn't even monetized. I'm making no money
Yeah,
off
yeah.
it. It costs me money.
Right.
Maybe I should fix that. But the thing is that it's an important thing to discuss: wellness, preservation, and that's really the focus of my podcast: how to preserve your sexual function, how to optimize your intimate wellness, all of those things.
Right.
And there's so much shame associated with it. I mean, for all the people that say to me, "What's a good Indian girl like you doing discussing sex?" Why? I mean, what's wrong with it? How is this any different than cardiology?
Right.
Or endocrinology,
Right,
with where you have doctors who do hormones, or oncology where people do cancer medicine. How is this any different? How is this any less relevant?
Right.
Or less important or respectable?
So let me ask you a question. When it comes to women, because I have friends on both sides where, there's friends that have a very high sex drive and they need it all the time. And then I have friends that, they're totally fine without it. They don't feel like they need it. They've gone 2 years without it and they're totally fine. Is that because there's something wrong? And is that based on, is that mental? Is it hormones? Why is there such a difference?
It's all of the above.
Okay.
And, I always say your most important sex organ is really your brain. So at that point, a lot of people, and, It's not just menopause. Perimenopause lasts an awful long time.
We're just learning that too,
Yeah,
right?
perimenopause, you could be in perimenopause in your 30s.
10 years
And
plus.
things can start to go haywire very early. And men, let's not forget menopause, as I call it, andropause. It's a thing. Men start losing testosterone at the age of 30, as do women. And so it's a gradual decline for them. For women, it's more abrupt in many ways.
Yeah.
Their estrogen loss and everything. But for men, they're leaking testosterone for years. So people think libido, low libido, just a female thing. Like, oh, women never want to have sex. Plenty of men don't.
Yeah.
So I feel that it's really a mix of all of these issues, because it's a combination. Because what happens is, if you're depressed, you're not going to want to do it. If you have low testosterone, you have a higher chance of being depressed. And then here's the kicker. If you're on certain antidepressants like SSRIs, you also have a chance of having low libido and erectile dysfunction and sexual issues. So what's a person to do, right?
And there's a huge percentage of the population on antidepressants, and particularly SSRIs.
And I always tell people, please, for the love of God, don't stop taking your antidepressant just because I said this.
Right.
We don't need people getting worsening depression, because here's the thing. It may not be a popular thing for a sex expert like me to say, but here's the thing. Not having sex isn't going to kill you. But if you stop taking your antidepressant, that may kill you.
Yeah.
Right.
For certain people.
Right.
So never stop. Come talk to me. Go talk to your doctor. But don't just stop taking it. It could very well be the reason. But let a doctor make that determination. Don't just stop.
And like you kind of said in the beginning, you're looking at the head to the toes. Like to me, that's a head to toes issue of getting that chemical balance in place.
Absolutely.
And the right formula of medications with the sexual health so that somebody can be, if they need the antidepressant, be on it and still enjoy and want to have sex.
Yes. And here's the other thing. Now, if somebody has depression, that's going to cause low libido, right? Then if they have hormones that are unbalanced, that's going to cause low libido. And they kind of feed off each other.
Yeah.
Because sometimes, because you have no libido, you get more depressed. And then you have even less libido.
Right.
Then the other reason why I firmly believe people have less libido is because they have less function. And they know they can't perform. So their brain just says, don't even bother.
And that's where you said the brain is like one of the biggest parts of sex. I believe that.
When I did that TEDx talk, I even said, if you think your best sex life is ahead of you, or if you think it's behind you, you're right.
Right.
Either way, you're right.
So that leads me to this question is, how does somebody know that they would need to come see you? Like, for example, a couple of the girlfriends that I have that are completely fine without having sex, they don't necessarily think there could be something wrong and maybe they need to come see you.
And
they might think it's
choice.
completely normal.
For some people, I mean, they have a right to not want sex, I guess, but it's a sad way to live.
But let me ask you this, because, I've been learning a lot more about perimenopause and menopause, and what I've seen the science coming out recently. The women, the doctors that are the menopause. Have you seen some of those women?
I've seen some of these doctors, yeah.
And they're talking about how, we're learning stuff now that we didn't know. And it's, if you put women on hormone replacement, they actually are protecting against heart disease and menopausal diabetes and all these ailments that they just attributed to women in aging. So it's not just the lack of libido to me. It's making sure if you're in that like late 40s, early 50s, that those hormones are balanced for protective purposes.
Yes, low testosterone even. Low testosterone can be a major indicator of cardiac risk.
And what you said before we started recording, I think, again, is so important for people to know. Women have 4 times the amount of testosterone that we do estrogen.
Correct.
And we don't know that. You said a lot of doctors may
Most
not even know.
Most doctors don't even realize
because they're not taught it, right? It's not focused.
It's not a focus of medical school. Now, again, I went to medical school many, many moons ago. I'm hoping that things have improved, but I can't imagine they have improved that much based on what medical students and residents tell me. So it's still not something that's a major focus of medical education, sadly enough.
Right.
It's scary when you realize that much of what I teach people, I taught myself.
I believe
it was not taught to me. Right. It's research, it's experience. Let me give you an example. COVID. When COVID happened, I started noticing that men were coming to me younger and younger with erectile problems. and they were talking about their penis shrinking. And when I started talking about it, people said, "Oh my God, that woman's a quack. She
Right.
doesn't know what she's talking about.
Yeah.
Bitch, be crazy." And so, did I just say that? I did.
Yeah. I like it.
So I said, "Listen, you can call me crazy, you can say anything, but it's happening. I'm seeing it in my patient population." And then the University of Miami went and did some studies and proved this. So what happens is during COVID, you have endothelial damage. The inside of your blood vessels are suffering, and there's inflammation and there's damage happening. So very much like plaque does, COVID can also cause this. And so women think that, hey, I'm not enjoying sex as much. Yeah, because your clitoris shrank. So what's the poor guy to do? There's not much there for him to stimulate. It's
So
easy to blame the
interesting.
men, but,
Right.
And
maybe
is it reversible?
I'm doing it all the time.
Are you?
Mhm.
So what kind of your treatments are you using to reverse that damage from COVID?
Well, there is no, and it's not just COVID.
Sure.
It's even natural aging and it just happens.
Environment, whatever.
Yeah, and men are shrinking too.
Yeah.
And so when I talk about it, people think, "Oh, that's not possible." Yeah, it is. How often are women actually looking at their clitoral size and comparing it to 10 years ago? I mean, we look at our laugh lines and our crow's feet and we bitch about those plenty.
Yes.
But
Wow,
when is the
yeah.
last time you sat with a mirror and actually looked and compared yourself? I mean, who
Right.
even knows?
Yeah.
So it's happening though. And when some women come, I actually have difficulty finding where to inject because there's just a nub left. There's nothing
Wow.
there.
It reminds me of the movie Fried Green Tomatoes, where they looked at their because she'd never seen it. She'd never looked at herself. You remember that?
And it
movie?
happens a lot.
I believe it.
So that's why I tell women it's easy to blame your partner. But what are you doing to contribute to the problem?
Yeah.
If you keep lying to him and pretending that, "Ooh, this is working, thanks, honey, that was a great orgasm," you're just telling him to do more of what isn't working. And as we discussed earlier, we discussed a lot earlier.
Yeah, we
didn't
did.
We
We
actually
did. We had a great
pre-podcast.
conversation, the pre-podcast.
So how are you expecting him to please you if you're giving him the wrong information? And men, I refuse to believe, the average woman's opinion that a man doesn't want to please, that he's a selfish lover. No, he cares. Most men want to please.
I
Right.
believe it.
But if you're telling him it's working, why is he going to change it?
Yeah.
So I have heard, and I don't know if this is a myth or not, that too much masturbation can reduce the
Sensitivity.
right. And could that be part of it?
No, it's not too much masturbation. It's the wrong kind of masturbation.
Okay.
So it's not a problem if you masturbate every single day. It's not a problem if you masturbate 3 times a day. The problem is if you use the same exact pressure on the same exact spot with the same exact vibrator, and maybe you're desensitizing that certain part because you're doing it exactly the same way every single time.
So it's repetition.
It's not even the repetition that's the problem. It's too much pressure. It's, for instance, with men, death grip syndrome. So they grip their penis so hard sometimes that they can cause damage. Now, Peyronie's, where the penis is literally bent,
Wow.
it happens because of injury. And most people don't even realize when it happened. It could happen during sex. It could happen during masturbation. It could just happen during life. But it's so avoidable.
It's actually something I saw on social. Of course, the number one injury is to a penis from reverse cowgirl. In like most positions, it was reverse cowgirl. And that's what you're talking about, where the penis actually
But it's not the only
breaks.
position where it can happen. So it's not, for women, ironically enough, that's a position that's more likely to orgasm in because there's more clitoral stimulation.
Right.
There's nothing magical about the position. It's just that it rubs against the clitoris more.
Right.
So that's how women are orgasming more. But it's also more likely to hurt him because now she's bouncing up and down, having a good time.
And no eye contact.
And they have to be careful.
Yeah.
They have to be very careful.
But
Wow.
that's where you're talking about, what you're talking about, where the penis is actually getting.
But it's not just that, though. You could have it during missionary sex, doing
Right.
it, standard, way everybody's been doing it for centuries, thousands of years. Just the good old missionary position can cause it too. So it's not the position. It's the fact that it gets injured. So you have to be careful. I'm not saying people cannot have rough sex. But be careful. There are risks.
Right.
In fact, one of my episodes was rough, raw, and risky, question mark.
I saw that. I haven't listened to it yet, but I'm definitely
Because
going
I hate to be that boring grandmother talking.
Right.
But I'm like, child, please. Do you know how much goes wrong with people when you act too frisky, nothing wrong with being frisky. Let me rephrase that. I just think you have to be careful. And it's like when people do, S&M, choking is a real issue. And I did an episode about it because choking has become a thing of late.
Yes.
And I actually have to have talks with my teenage sons, and they say, ew, that's gross. And I say, no, you will shut up and listen to me. Don't get into all this kinky stuff. They're like, Mama, please. And I say, no, listen, your age group is doing this.
Right.
And it's not okay. Because there are people who are killing their partner during choking because it's supposed to be some kind of turn on. I'm sorry, you're killing people. And in some cases, in my opinion, it's worse to survive with brain damage.
Yeah.
I mean, what a life that is.
Yeah.
Not one I'd want to lead.
But it's interesting because, again, having the conversation with teenagers, because they, again, going back to your assertion that men want to please. So you have a teenage girl that sees it on social, or a friend told her about it, choke me, and he wants to please, and they don't know how much or what to do.
They don't know.
Have no idea.
People aren't doing this intentionally to hurt people, but people are getting hurt.
Exactly.
Right.
And the problem is that vanilla is such, a four-letter word now. Like, vanilla, ew, we don't want to be vanilla.
Right.
But do you really want to end up maimed? Do you want to be paralyzed? Do you want to end up dead? At some point, let's use common sense here. I'm not saying things have to be boring, but for the love of God, let's not go crazy either.
Right.
It's like, I saw this woman, she's talks about herself as something of a sex expert or whatever, has no credentials, by the way, goes around talking about all these different kinds of orgasms, including a throat orgasm. Like, what the hell? Come on.
Wow.
I even did an episode about that. It was literally titled Throat Orgasms and Other Crazy Things They Want You to Believe.
Wow, that's crazy. I haven't heard of that.
I mean, it's one thing to please your partner, but let's not kid ourselves that somehow it's going to make us orgasm as women.
Right.
So, I mean, it's just ridiculous.
So when you talk about like vaginal rejuvenation, for example, is it obviously it's tightening, making the hole smaller?
Not necessarily. Some women are too tight.
So can you fix that?
Yes. Also, cancer patients, they become very tight. There's a lot of tissue loss. Chemo can kill the cancer, but it also kills healthy tissue. So cancer can be a huge, huge problem for both men and women. I mean, men develop issues with ED because of it. Women develop vaginal dysfunction because of it. And also vaginal rejuvenation at my practice, Bawa Medical, is about more than just one or two treatments. And I really don't have a menu. A lot of people call and they'll be hateful to my front desk and say, but I just want to know the price of vaginal rejuvenation. And they say, do you realize you're calling one of the world's most advanced medical practices?
Right.
We don't have a price list because it's not that we're trying to avoid the discussion. It's just that we don't do cookie cutter medicine. You should be happy about that.
Right. Yes.
But they get mad.
Right.
Because people price shop.
People price shop, but you get what you pay for.
It's true.
It's entirely up to them. But we give people a quote once we have a consultation with them. But until such time, how do you know what they need or what their goals are?
And it's so specific to each person.
That's
like
how
you're
I
saying,
do it.
because it's, if you use the bucket analogy, the holes for each person are very different.
See, you get it.
Yes.
And that's the thing. So for me, this is my calling. I could make money a lot of different ways, but I'm very passionate about what I do. I'm very passionate about educating. I'm very passionate about, I call, my followers my tribe. My tribe is benefiting because of what I'm doing. And it's about more than just taking home a paycheck for me.
Right.
I made a pretty fine paycheck as an ER doctor. If anything, I make less money now. People might find that hard to believe, but my office, the technology is frightfully expensive.
Right.
And I have the best in the world.
Yeah.
And I buy it brand new, and I refuse to buy even gently used, quote unquote. And I have so many different machines because I do what is required for that person, not just based on what I have available. Most places you go to, they'll just say, oh, this is the best. This is what you need. Well, they don't have anything else to give you.
Right.
And not that being an ER doctor is easy, but you're also running a business, which is a whole like another aspect
That's a
of what you're
nonstop
doing.
job,
And
yeah.
nonstop, yes.
No, it's like, how many jobs do I have? I'm a podcaster.
Yeah.
With, you know, a top 1% podcast. I mean, your podcast is doing well too now.
Yeah, we're doing pretty well.
Yeah,
We're
and you're new. This is great.
Yeah, we just are about to hit our first year. So yeah, it's fun.
This is great.
We love it.
I think it's so important to have conversations like this.
Yes.
Because, you know, you are two women out to educate and have discussions that people aren't necessarily having. And I'm doing the same thing. I'm trying to have discussions people are not having.
Right.
And now for us to get together like this, think of how many more people are going to learn.
Right.
And that's why you have to come on my podcast too.
Absolutely.
Yeah, for sure. I would imagine that it's very taboo.
Yes,
I can't
very
imagine
taboo.
people are discussing with their family and friends, I have an issue. So you have to put all of your content out for people to be comfortable enough to just come to you directly and know where to go and do the research. Because I can't imagine somebody's be like, oh, well, I used Dr. Bawa for my penis
You know, it's
enhancement.
very hush-hush. It's very hush-hush. So it's sad because if people could just be honest with their friends, women are hush-hush about it too. Women don't tell each other that much either. And men certainly feel like they're less macho if they tell somebody about it.
Right.
But they need to understand that everyone is suffering. Do you know that ED goes up 10% for every decade of life?
Yeah, I heard you said there's men in their 20s that are suffering from it.
Yes, that was one of the most hard to believe things that I ever encountered. When I first saw that, you know, back in the day, you know, we used to have paper charts, clipboards. And I'm dating myself when I say that. So I looked at the chief complaint and it said, cannot have erection. And I started looking around thinking, somebody's definitely playing a prank on me.
And you literally thought they were playing a prank because that
somebody
happens
was
in the
playing
ER.
a prank on me. They certainly didn't teach you about it in medical school. Like, I was like, come on, 20-something, this is ridiculous. And then I go in fully expecting something from my ER colleagues because, you know, ER colleagues do funny things sometimes. And it's not that they have, you know, low IQs. It's just that sometimes we need to do that to just survive in the stress of an ER.
I would say it's a pressure valve.
Sometimes, you know, we're just playing pranks on each other just to be able to survive through it. It's a rough thing.
Right.
And you do what you have to do to make it through a day. And so I completely expected something silly when I walked in, except there was a man slumped over, young man in his early 20s. And to him, this wasn't a joke. And that's what really got me thinking about it.
I mean, you think about a human being suffering, a young man in his 20s that can't have an erection, that's suffering.
Yes. And the other thing is, everybody assumes that it's mental.
Right.
It's not always mental.
Well, that could also be alcohol-induced,
could be
drug-induced.
Lots of things. And young men are smoking too.
It could be just a general health
autoimmune problems.
Yeah.
I mean, young men have issues too.
Yeah.
So if a man in his 20s is having trouble, why should a man in his 50s feel ashamed?
Yeah.
It's a human condition. It's not something to be ashamed of. It's what happens. It's who we are. It's what happens to us. If we're not ashamed of heart disease, why are we ashamed of sexual disease?
Right.
I think we need to take it out of the closet and start discussing it for the problem it is. Because till we are honest about it, take it seriously, discuss it seriously, nobody's getting better.
Right.
And it's not just about function. What about pleasure? Why isn't anyone talking about pleasure? Pleasure is like another taboo word. We're not allowed to feel pleasure. Why?
I know it's interesting. It's like, I don't know, maybe it's from our, you know, Judeo-Christian background where we didn't talk about it. Yeah. And it was considered, you know, for making babies.
Yes.
That's why you did it. You didn't do it for pleasure. And the women that did it for pleasure in particular were like,
you know, that
the prostitutes,
that
right?
whore mentality, you know? And I'm using that word because it's not even, that's what women are called, right?
Yes.
Right.
Women who enjoy sex or pleasure, very often, we don't even say the prostitute, you're being polite about it. But isn't that what we call, not we, but, you know, isn't that what women are called, whores?
Yes.
Right. Absolutely.
So that's not a very nice thing. And we grow up with that in our minds. We don't want to be whores.
Right. And I wonder if there's also something to be said for mothers because, you know, I'm not very comfortable talking about pleasure. And I'm wondering if that's, you know, partly because I have a daughter who I try to don't have sex, don't have sex, don't have sex, don't have sex. So maybe there's a part of maybe moms that feel like it's a hypocritical thing or
Well, the thing is, it's almost like once you become a mom, you're not a sexual being.
right.
Something about pregnancy and childbirth takes that away from us. And I don't think that should be the case. Because I personally feel that women are hotter, sexier as they age. I don't want to be the woman I was in my 20s. I really don't. And I'm not saying that for a fact. I really don't want to be her. I'm way cooler now.
Agreed. I agree with that wholeheartedly.
And I honestly feel like I've come into my own in my 40s.
Right.
My body may not be what it was in my 20s, but who I am is way cooler.
Yeah. I completely agree with
way
that.
more. I'm way more confident in
Oh,
my
yes.
40s. So like, it's just a different era. And I heard women saying this when we were younger, and I was like, maybe I'll get there. And I'm like, yeah, I'm there.
The whole concept of MILFs.
Yeah.
Now, I hate the term. I really hate the term.
Yeah.
To me, it's just, and I did an episode about it with a porn star called Brandy Love. She's like the queen of MILF porn. And I had no idea who she was at all. And then my employee's husband said, Dr. Bawa, that's Brandy Love. I said, Brandy who? And I really didn't know.
Right.
And so when I met her, she was delightful. And I had a really, really great conversation with her. And so I said, I should have you come on the podcast. Because again, there are preconceived notions about who a porn star is, right? She
Right.
cannot be intelligent. She cannot be cerebral. Brandy is a beautiful woman, of course, but she is intelligent. She is a savvy businesswoman. She is married. For decades, she's been married to the same man.
Yeah.
So assumptions, right?
Yeah.
Right.
And so when you think about stereotypes, we need to stop thinking about people and putting them into these little holes, these little slots where
Right.
they have to live. So I'm not saying that anybody should go be a porn star or not be a porn star, but I found her interesting. And when I looked her up, I realized that she was, the queen of MILF porn. So I said, let's talk about it. It's an interesting topic because I like having interesting conversations.
Right.
It's not just about telling people about my treatments, which I think are fabulous, but it's also about discussing taboos, discussing attitudes. And, she's right when she says that, a MILF is a strong woman, a confident woman. And I don't think that the average 20-year-old has what that MILF mentality is,
Right.
that these younger men find so
100%.
attractive. And I think that we as women at that MILF age
Yeah.
need to realize that and own it.
Right.
I'm not saying you have to go become the queen of MILF porn, but what
Or
I'm
MILF
saying
anything.
is, or MILF anything.
Yeah, right.
I don't even like the word
Owning
Right.
it.
or the
yes.
term. But my point is that concept of a woman in her 40s, 50s, 60s being that hottie patati who has it going on. She has life experience. She has maturity, probably some bucks to her name too. She's been out there. She's fought the fight. She has
Right.
won many, many battles in her life, and she has battle scars to prove it. It's
Right.
time for us as women to stop hiding those battle scars, to own them, and give ourselves the permission to enjoy sexual pleasure. And we need to stop thinking of it as, I'm not that bad yet. If your viewers and listeners learn nothing else from this, they need to understand that. Stop that concept of, I'm not that bad yet. When is the last time you had a Meg Ryan orgasm?
Right.
Yet most women are capable of it.
Right.
And even the concept for me of, I'm in my 40s. I don't, want that Meg Ryan orgasm anymore,
Yeah.
or 50s. Because we have some friends, or I have some friends that, maybe they're like, oh, I'm in my, like you said, friends that are like, I don't necessarily need sex anymore, which is fine. I'm not saying that.
That's their decision, but
Agreed. But I guess my point is make sure everything is functioning, right?
Yes.
Going back to that.
because
Because
You might be
decide.
selling yourself short if you don't check it out.
Exactly. And
Yeah.
decide that like you're healthy and that's your decision from a healthy, like physically
Exactly.
perspective versus just giving up because you're suddenly a certain age. Is what I
I'm
guess
sorry.
I'm
I'm
saying.
making women orgasmic all the time.
Right.
I'm making men harder. I'm making them
Right.
bigger too. I'm making dreams come true. And I say that because there's a lot of shame that men have to endure when it comes to penis size.
Yes.
Because we have normalized a conversation around breasts and butts. If a woman wants a bigger butt or bigger breasts, she goes and gets them.
Yes.
And nobody thinks twice about it anymore.
Right.
But if a man wants a bigger penis, many times he's ridiculed. Why the hypocrisy?
Right.
I mean, it's interesting. Maybe because it wasn't easier for them to go get it until recently.
I think it comes down to, again, attitudes where he's not man enough.
Yeah.
No, he's man enough. He just wants a bigger penis. It's got
Yeah.
nothing to do with, how much of a man he is. It's just a concept of he wants a bigger penis. Sometimes it's just about that.
Yeah.
Right.
It's not that he's less of a man. He just wants a bigger penis. Are you less of a woman with smaller breasts? You're not. You
Right.
just wanted bigger breasts.
Right.
So what's the difference?
For those that are listening to this or going to listen to this, and they're thinking, oh my gosh, I don't know if there's anything wrong with me, but this is super interesting and I'd like to get checked. Is that can somebody just come to you and say, I don't know if there's something wrong, but can
That's
you check
why they have me. Yeah. They can call my office.
And then you can say.
And then we can set up a consultation. And I do a very detailed consultation. I ask people detailed history, like, what's your history with internal orgasms? Have you ever had one? Tell me about your external orgasms. Sometimes people don't know the difference, but there's a difference.
So that's super interesting to me. So what is it? Are there a lot of women you see that have never had an internal orgasm?
Yes, but I don't think it's because women can't achieve them. I think they just haven't gotten to it.
Yes,
because
I
again,
agree.
This is what every therapist will tell you. Or not every therapist. Don't hate me, people. Don't send them hate mail, okay? Just send it to me, whatever.
Many therapists.
Because there are some good therapists out there, I'll be honest. And, people are going to say, oh, she just hates sex therapists. Not true. I have great relationships with a lot of sex therapists. But I'm talking about the general consensus is that, women can only have external orgasms because the clitoris is out there. And so don't try for the internal orgasm. You're setting yourself up for failure. Not true. Because here's the thing. You hear about the G-spot.
Mm-hmm.
There's no such thing as a G-spot. It's actually the extension of the clitoris. Because the clitoris is not just a tiny little thing on the outside. It goes in. It's analogous to the penis.
Yes.
And so it extends deep down inside. So it's kind of like a horseshoe thing.
Right.
So those inner parts is what people are finding very pleasurable. That's that so-called G-spot, but it's not a G-spot. It's not a G anything. It's still the clitoris. Right. And I think people need to understand basic anatomy. You don't have to go to medical school. But if you can understand that there is this sensitive area, and sometimes if you just move a different way, if the man just sits maybe and you straddle him, doesn't have to be cowgirl. You could do it sitting down. You could actually be sitting. I do episodes from time to time about sex positions for this reason. Like you could literally be sitting with your legs wrapped around his back. And that position is probably more likely to stimulate your, internal clitoris than missionary or some of the other ones. It doesn't have to be full on cowgirl. Experiment.
Right. Wow.
Just don't be rough about it.
And that actually too is something that is that something you see where, because there's a little bit of jokes in our society about it but I actually think it's super important, at least for me as a woman. And I guess I'm putting myself out there a little, but somebody said it somewhere, something I saw, foreplay begins as soon as you've had sex the last time.
Yes.
But between partners, let's say, right? And I think that's so true, because it might be where, it's not just the touching of the parts that feel good.
Mm-hmm.
And I think that sometimes, and this is where I will ask men to kind of slow down and take some time with the woman, because I think we are built differently, and it's cerebral for one, for a lot of us, I believe. And then you want more of that foreplay, other areas than just.
Yes. The true orgasm, when we women think about orgasm, many of us think that if a woman's not squirting, she's not really having an intense orgasm. That's incorrect. I think you could have a perfectly fine earth-shattering orgasm and not squirt at all, because some women are squirters and some are not.
Right.
Some women can learn to squirt. Some people don't want to squirt. So squirt, don't squirt, irrelevant. But sex is about more than just grabbing the genitals. And I do think foreplay begins outside the bedroom.
Right.
And it begins long before that evening begins.
Right.
And I think that if your relationship is healthy, then your sex life will be healthy.
Right.
And it's that communication, I think, of maybe it's a sexy text message or it's
Absolutely.
and I think you said it on a podcast I listened to. It's like 7 minutes of kissing daily.
No, 6 seconds.
6-7 seconds was
Yeah.
what.
So
6
yeah,
seconds.
6-7 seconds. So the problem is that when I first thought about it, I thought that's it. Just a 20-second hug and a 6 or 7 second kiss. That's it. And that's what we're aspiring towards. I mean, is that what the life, our life has come to?
Right.
But then you actually sit and time it. And you go 1, 2, 3, 4, 5, 6.
Right.
It's not a bad kiss.
Right.
No.
Versus the peck you might give your
Yeah.
partner running out the door. What's that, a second?
If
Right.
that.
If that?
Half a second. Yeah.
Yeah.
But that's what I'm saying. It sounds like nothing, but then you sit and you count it out. That's not bad.
Yeah.
And I'm not saying it's a long, passionate kiss, but it's better than a peck. And a 20-second hug. My friends now joke, they say, wait, let me give you a 20-second hug. And then they stand. I'm like, oh my God. Another one of those.
Because it produces, is it oxytocin in the body?
So now I get 20-second hugs because now people have heard my episode.
Right.
Oh
Like,
my
wait,
gosh,
we haven't
that's
hugged long enough.
funny.
So then I say, hold on.
But I think it's so true that you can become very complacent in your relationship where that doesn't become the norm anymore. So
Yeah, even hugs are so quick.
yes.
So when you think about it, it sounds, initially when you hear it, it seems like nothing. 6-second kiss, that's nothing. But compared to our average kiss, that's a lot.
Yeah. And I just think it goes such a long way in maintaining that connection. And again, just for me as a woman, like that, when I feel that, it's so much easier for me to
to get in the mood and
be
do
in
all
the
of
mood
that.
and, so I don't know, that to me is like where I would say because I do think that women put a lot on men when we don't share and don't give them the right feedback and don't think they want to please us. I think that's all actually true.
Yeah,
they
and
do.
I also tell men that, because I do non-surgical penis enlargement, but, I call my method Bawa Big. And Bawa Big has become a real thing. It's really caught on worldwide because I'm not doing implants and I'm not just doing fillers either. So my way is actually making men thicker long-term. It's not permanent, but it's long-term. And so when men get bigger, they think that the longer they get, the better it is for the partner. Because I promise you, I speak to so many men and they really want to please.
Yes.
That's why I'm saying that the average woman is not giving her man enough credit.
Right.
And now every woman is going to hate me.
I
Not
don't
just
think
the
it's
therapists.
true.
Right.
Hopefully
But-
they start to just
Yeah,
hear it
yeah.
and believe it.
And I tell men, listen, girth is where it's at. And 100% of men who walk into my office walk out thicker, who come in for Bawa Big, 100% of men. And there's very little in medicine you can say 100% success rate for. But I say to them, don't worry about length.
Yeah.
We'll get you there. I mean, most men are getting at least a little bit longer, but I never promise length because you can't really predict it.
Right.
And I'd rather under-promise and over-deliver than the other way around. But it's not over-promising when I say you're going to walk out thicker 100% of the time. I said the most important part is girth.
Right.
And I'm 100% going to give you more girth. So relax.
Yeah.
Chill.
I have a funny story, personal story. So, well, it's not really funny, but I was with someone who was very long and it did nothing for me because it was so long that part of him was still sticking out and there was no friction.
Mm-hmm.
And so it really was like, no, that's just not.
But something interesting? Again, you'll say, oh my gosh, she really hates sex therapists. But they talk about a lot. And I don't hate sex therapists. But,
I don't believe you do,
But here's
but
the
it's
thing. Here's the
funny.
thing. But I'm just, telling you stuff I hear.
Yeah.
And so much of what I do is, going against misinformation out there. So they'll say, oh, women don't care about penis size. Yeah, they do. And I'll tell you why. They did a study where they talked about penis size. So they literally put 3D models of penises out there. People think I make this crap up. They really do, I think, because I do enlargement. So they think I have a vested interest in talking about it. But I'm just giving you the actual research.
Right.
Go hate the researchers.
Right.
Don't hate me. Don't
Go to
shoot the messenger.
PubMed.com.
Right.
Yeah, go hate them. So they literally put these 3D penises out, which I thought was genius. Because if you say to somebody, how many inches do you like? Well, what does that even mean? But if you look at a size, you could say, I'll take that. No, thank you. Too big, too small.
Right.
So they literally put them out there and said, have at it, ladies. What do you like? What floats your boat? And they picked. Now, the average man, fully erect, is 5.12 inches long. Okay? And I always hear men say, I'm 10 inches. Congratulations.
Right.
You know, and there are men who say, well, I'm 2 inches. I doubt that most men are 2 inches, but you know how it is. Self-perception can be very skewed.
Right.
Just like the 10 inch is probably not a 10, the 2 is probably not a 2.
Right.
Yeah.
But that's why the average is 5.12. But the average woman wants her long-term partner to be 6.3 inches. I have to think for a second. So many numbers. 6.3 inches erect. But if she's having a booty call, hello, she wants him 0.1 inch longer. So now she wants him 6.4. So people say, oh, that's nonsense. Women don't know the difference between 6.3 and 6.4. I agree. But the point is, they were shown penises
Perception.
and they picked the bigger one to have a booty call with,
Right.
which means that even in their minds, even if it's slightly longer, a bigger penis means more fun.
And
So-
they're it's more of a guarantee that job's going to get done, I guess.
Exactly.
Maybe.
So don't tell me that women don't want bigger penises. There's research to prove otherwise.
Right.
I'm sure there are 50 studies to say that women don't care about size, but there are probably 50 more to say that they do.
Yeah.
I mean, in medicine, you'll find a study to prove anything.
Right.
You know,
Right.
you have a point of view, you'll find something to prove your point.
Right.
Unfortunately.
So, so yes, women do care about size, and yes, men care about their size. And you know, you don't want to have a micro penis. Let's be honest. What's a micro penis going to do for anybody, for the man or for the woman? Nothing. Now, that's a tough situation to be in, and that's an unfortunate thing to have to deal with. Now, the average man isn't a micro penis, though, but some of them do think that they're smaller than they are. They don't realize that many of them are above average. They all think that they need to be 8, 10 inches. Women are looking for 8, 10 inches. That sounds painful,
Yeah.
Yes.
you know, but they want a solid 6.
Right.
Now, if I had a measuring tape here, I would show you the difference. It doesn't sound like much, but when you look at the tape, you're like, ooh, okay, that is a big difference.
Right. So I know we're almost out of time, but I wanted to talk. You have a new product or
Supplement line
supplement?
for
Yes, I've
helping with
actually had
libido, right?
Dr. Sex Fairy supplements now for a couple of years. I have pretty much only sold them within my practice and to my followers, you know, for the podcast and social media. And they have been a runaway hit. We're always sold out. And it doesn't matter how much we make, we're always sold out. And it's one of those things where we only do it in small batches. So because, I don't know, maybe I should just bite the bullet and just make a huge batch. But I keep thinking, you know, you keep thinking, well, who's going to buy so much? And then they do.
Right.
And
I think you're answering your own question.
Yeah.
Yeah.
Just produce a bigger batch.
Just bigger batch. But I also want it to be fresh.
Mm-hmm.
So I want to make sure, and it's US made. So, and it's all 3 of my supplements are unisex for men and women.
Okay.
And to your point earlier, like I had mentioned to you before we started filming, that women have 4 times as much testosterone as they do estrogen. So my testosterone booster is good for women too. Because if you think about it, low testosterone is going to cause libido issues. It's going to cause weight gain. It's going to cause depression, lack of mental clarity, you know, like mental fog.
Right.
So it's not just for men. Women need it too.
And it really general lack of energy.
Yes. And so it works for both men and women. And then I have a nitric oxide booster called Enhance. So there's Renew, the testosterone booster. There's Enhance, the nitric oxide booster. That increases blood flow. And not just to your parts down there, but to your skin, hair, nails. So not only do you have better sex, you look better having it. And again, you need blood flow, even if you don't
Everywhere.
have a penis,
Yeah.
right? We all
Right.
need blood flow. And
Right.
so that's important. And then Passion is my libido supplement, but it also helps with function. It's kind of a two for the price of one kind of thing. And you'd be surprised. It's not just women who love it. Men do too. Because at the end of the day, men have low libido problems as well. They just don't talk about them
Right.
because it's not manly enough to
It's
admit
taboo.
that you're not
Right.
feeling it. Because men are supposed to be like Energizer bunnies, right? Like go, go, go. And women are supposed to always have a headache. But sometimes,
It's
yeah.
coming out now that it's often in people that have been married long term the other way around. right?
Yeah.
So you're right. There hasn't been talk of it for so long. It's always been she has the headache.
Yeah.
Not tonight,
We have
dear.
too many stereotypes. And that's
Yes.
what's killing our sex lives, is that we have so many stereotypes. We are making it impossible for ourselves. How are our bodies ever going to catch up? Because our brains have already assumed all this. You see?
Right.
It's where you start to catch yourself with the assumptions that you're making.
Mm-hmm.
Yeah, it's true. I mean, that's life-changing advice right there in life, not just in sexual health and sexual stereotypes. If you can catch your brain where the assumptions it's making, it will change your life. But I like it in this area a lot because
Well, thank you.
so many things that you've said, it's just probably been, put out there by the culture, by the conversations, by movies and TV for so long,
Yes, I think people need to stop thinking that sex happens only in the bedroom. Sex starts long before you get to the bedroom. I think sex needs to be about more than just, jackhammer thrusting. I think there's nothing wrong with porn. I mean, I have no money in Pornhub, so don't come hating me for that now. But I'm just saying, porn is not the enemy.
Right.
It's compulsion that's the enemy. And you can have a compulsion for anything. You could have a compulsion for too much alcohol or anything. So it's not the porn that's the problem. Just don't use it as sex education. Use it as entertainment.
Right.
And some people enjoy it. Some people find it easier to orgasm with even the sounds in the background. So who am I to judge what helps people in the bedroom? If it helps you, go for it. As long as you're not hurting anybody, you're not doing any kind of, illegal sick porn.
Right.
It's okay.
Yeah.
Right.
We're all adults.
Do what you need to do. Live your life. Stop judging others. Stop judging yourself.
And start talking about it.
Does this mean you're going to talk about it more with your daughter?
Probably not with my daughter, but I would love to have her back on here. And I feel like we've just scratched the surface.
I really think you should talk about it more with your daughter. But
Talk
we'll
about
talk
more
about
sex with my daughter.
I mean, about sex as a topic, not necessarily that she
We've
needs to have
definitely
it.
had a lot of talk about sex, but not to the extreme of orgasms and things like that. No.
I think.
But we've had a lot of talk about
I think
sex.
a mother should buy her daughter her first vibrator. I believe that. Because it's not going to make her, again, like we were saying, the whore mentality. We always think that pleasure is a bad thing. Pleasure is not a bad thing. If anything, if she's having her orgasms and is content on her own, she's probably going to make better decisions, choosing the right partner.
Well, she's only 14.
That's different. Eventually.
About to be 15.
Right. But whenever you're comfortable.
Right.
I'm not trying to tell you to buy her vibrator at 14. But whenever you decide to buy it, I mean, whenever you think she's old enough, I think it's a better thing for her mom to give it to her because it's also sex positive.
Mm-hmm.
Right.
Where you're saying it's okay to have pleasure in your life.
Yeah.
That's kind of what I meant.
It's
from
okay.
that perspective.
And I know what you mean. That's why I'm saying that, it's okay to own your sexuality.
Oh, yeah.
It's okay to own your pleasure. And you're not dependent on anybody else for that pleasure.
Right.
And I do like your idea that is going to help a teenager make better choices.
I think it's more empowering.
Yeah.
I think there's too much concept of, sex toys are dirty, sex toys are bad. I think couples should use them too. And I even had an episode about it. Why her sex toy is your friend? Because stop thinking that it's somehow going to take over. Women don't want to have a relationship with a sex toy.
Right.
It's just a way to orgasm.
Right.
And it's just another tool in your tool belt, guys.
Right.
Buy a damn vibrator or two.
Yes.
Or 5.
Yeah.
And just be a little careful if you use it in the ass.
Yeah, try not to lose it. I know.
Try not to lose it.
Because I have, been
You've
faced
seen
with that
it.
many
Oh my
times in
gosh.
the
You've
ER.
seen it. Yes.
And on that note,
You're welcome. I'm the sweet one, remember?
Yeah.
This was amazing. Thank you so much.
Thank you for having me. I had a good time talking to
we
you.
have
need
to
to
come
come
back.
back.
For sure.
Absolutely.
But thank you also for just, talking about subjects that are taboo and educating people with real talk about the subjects. I think it's very important.
Super important.
Yeah.
I mean, all the sex therapists hate me now, so thank God at least somebody likes me.
I think there's a few out there that are very happy you're saying what you're saying, and they'll probably be on your side. I know you said you have relationships with them.
I do have good relationships with a lot of sex therapists because I actually refer patients to them.
Yes.
Because I think a lot of times people need therapy, and it's okay. It's, like I said, it's okay to normalize discussing these issues. It's also okay to normalize mental health.
Yes. All of the above.
All of the above.
Yeah.
Well, again, thank you. And we look forward to an additional conversation down the road, but really appreciate you being here, Dr.
Maybe we'll
Bawa.
bring my 14-year-old in here the next time.
She could ask some great questions.
She could.
And
That
it would
might
be
be very
actually
interesting.
Very interesting.
Maybe we'll do an episode about how to talk to your child about sex.
That would be great.
That would
know?
be a great
See?
one.
Maybe
Good
I'll have you
ideas.
on my episode, on my podcast for that.
Yeah,
great.
that would be great. Really great.
Yes. Well, thank you again. And be sure to
Stay tuned.